Hello, I am Robert Weldon. I shall be your nurse today. I shall be taking care of you. Normally I would close this curtain for your privacy, but for demonstration purposes I am going to leave it open. I would verbalize hand hygiene, wash my hands. Will you please state your name and date of birth? Oh, well, it's glad to meet you, Miss Amy. How are you doing today? Oh, you're doing wonderful? Okay. Well, at this point, I would apply my gloves. A little bit of difficulty, but it's okay. I got them. This is a clean procedure, not a sterile procedure, so it is okay. Then I would raise the bed up into a high Fowler's position, which it already is, and if needed, I would lower the side rail, which it's not moving for me, so I'm not going to lower it. I have problems with the side rail, but that is okay. At this point, I would give the patient a linen saver and water, as well as a basin in case they were to throw up or vomit or anything like that. Now I would have to ask the patient, have you ever had an NG tube placed before? Oh, you have? Which nostril was it? Oh, your right one? Oh, that is so inconvenient for me. I am so glad. Okay, well, now I would ask the patient to blow to clear the nostrils. They are good. He is right. The right nostril will be the better nostril to use. At this point, I'm going to, I should have done my tape earlier because it is harder to do it with gloves on. But, you know what? I'll make it happen. There's one. Now the fun part is I have to make a pair of pants with one pair of tape. So we'll see how that goes real fast. I'm going to have to take my gloves off for this, but it is okay, don't worry. Well, Miss Amy, how are you doing today? You're doing well? Well, letting you know, I'm going to tell you about the procedure as I'm doing this. I shall be placing an NG tube through your nostril to your stomach. Now doing this, I will be able to relieve some gastric juices to make sure that it's there's my pair of pants. I'll be doing it to make sure that in case you need to be fed or just to check the pH of your stomach and all. But at this time, I am going, this is lubricant, but we are told not to open it. Okay, so I will now measure from the nose to the ear, and from the ear, see, I'm going to move this real fast, to the xiphoid process, and it is at 46, so that is where I would normally mark it or place a piece of tape, but that's where it would be. I would give them back their basin. Now, at this point, I would coil it, making sure that it is flexible and able to go down and it's not, tight so it doesn't hurt the patient at all. Now, would you like some water before I insert this for you, ma'am? Oh, there you go. Okay. You are so sweet, Okay. Now at this point, I would lubricate it. It is lubricated. Now, will you raise your head backwards? Thank you. I'm putting it into the right nostril, so about to the back of the nasopharynx, and then I'm going to ask the patient to swallow as they have their head forward. Swallow. Swallow. There. Swallow. There you go. Swallow. Swallow. Oh, you're doing a great job. Swallow. Oh yes, we're almost there. Don't worry. Swallow. Swallow. Swallow for me. One more time. There we go. Okay. Well, that is as far as it is going, but normally I would go until the marker. I'm about too short, but it is okay. For demonstration purposes, I shall continue. At this point, I would take a piece of tape and secure it to the cheek. Hopefully it stays for me. There we go. Now, I will take and pull out some gastric juices to make sure, probably about 5 milliliters, yes. Okay, and I would be checking to make sure. I will reclamp this as well. Yes, it is 3. The pH is 3. That is perfect for the stomach. And now I'm going to just go ahead, give the rest back, reclamp it closed again. Now, at this point, I shall give the patient the tape pants to safely secure to the nose. Now, after I have secured it to the nose, I will take the tape and secure it to the patient's gown. Then I would remove all the trash, take off my gloves, hand hygiene. I would lower the bed back to about 30 degrees for comfortable position, give the patient a call light. I would ask the patient how they took it. How did you take the procedure? Oh, you took it well? Oh, I'm so glad for you. I would document it. I would document the size of the tube, which nair I used, if I got it all the way in, the gastric juice, and if I secured it or not. 2 weeks later. At this point, it is time to remove the NG tube. Hello, I am Robert Weldon. I shall be your nurse today, and we shall be removing this NG tube for you. Now, I'm going to close the curtain again to secure privacy, hand hygiene, and then apply gloves. I would normally not have gloves on at this point, but now I would apply them. Will you please state your name and date of birth? Yes? Oh, hey, Miss Amy again. Are you ready to get this NG tube out? Okay, I am so happy for you. At this point, I would provide a linen saver in case we have any problems. I would take the tape off, and then I would make sure that they are up and ready to go in the hypallic position again. And at this point, I would have a Kleenex, and I would take it, put it in my non-dominant hand, well, I should probably remove the tape so it doesn't get stuck first. Remove that tape right there, and I would have a Kleenex right here for the patient. And I'm going to pull in one steady motion. Now, will you please hold your breath? Oh, thank you. I would take this, and I would discard it into a red biohazard container. That is my red biohazard container. And I would offer the patient a warm washcloth to clean the nose. Miss Amy, would you like a warm washcloth to clean your nose? Oh, you would? Do you want me to assist you? Oh, okay. I am so happy to assist you today. There you go. Now, how did you take the procedure? You took it very well? Good, I'm glad. Now I would take the linen saver and discard of all my trash. I would take my gloves off. I would wash my hands. I would make sure that they have the call light and they are at a comfortable position again. And then I would document how well the patient took the procedure.